BrainicityTM Sound, Visual, and Red Light Therapy System. Dr. John A. Aloka. January 30, 26. www.aloka.com. BrainicityTM Sound, Visual, and Red Light Therapy System. BrainicityTM Sound, Visual, and Red Light Therapy System. This inexpensive system produces red light, not near-infrared light. Red light has a wavelength of approximately 620 to 750 nanometers. Near-infrared light is 810 to 880 nanometers. Near-infrared has deeper penetration, however it is more likely to lead to overstimulation than red. Red will produce less tissue penetration, however there is scattering of light within the body. It may just take longer for red only to be effective. Bulbs used have a standard replaceable E26 base. Be cautious of advertised products. In addition to the red light system is the BrainicityTM Brain Enhancement System. Unlock your brain's potential. At Aloka Biotechnology, we believe that true health and wellness come from optimizing every aspect of your body and mind. That's why we're offering our BrainicityTM Brain Enhancement System, designed to enhance your cognitive function, memory, and creativity. Our approach to brain enhancement sets us apart from the competition, as we address not only the physical but also the emotional and mental aspects of brain health. Take advantage of this offer now and experience the benefits of a sharper, clearer mind. Reduce stress. Awaken consciousness. Support healthy brain function. Red light therapy. Red light medicinal therapy, more formally called red light therapy, RLT, or photobiomodulation, PBM, uses specific wavelengths of visible red and near-infrared, NIR, light to stimulate cellular repair and reduce inflammation. It is non-invasive and has been studied for pain, tissue healing, skin health, and some neurological and metabolic effects. Blue light versus red light. Excessive blue lighting can have the opposite effect of red light therapy and cause many health problems. Light bulbs that have a color temperature of 5000 K contain a lot of blue light. It is advisable to change them to 2700 K lights. A few red lights may also be placed strategically around the house or office. Body penetration. Wavelengths. Visible. Violet light, 380 to 450 nanometers. Blue light, 450 to 495 nanometers. Green light, 495 to 570 nanometers. Yellow light, 570 to 590 nanometers. Orange light, 590 to 620 nanometers. Red light, 620 to 750 nanometers. Not visible. Near-infrared, NIR 810 to 880 nanometers. Infrared, IR 750 nanometers to 1 millimeter. Range of common lighting. Candle, very warm 1800 to 2200 K. Incandescent, warm white 2700 K. Neutral white, 4000 K. Daylight, 5000 to 6500 K. Blue tinted, 8000 plus K. Safety. Wear eye protection for near-infrared lasers, especially around eyes. Normal red LED spectrum. How red light therapy works. Summary. Red and NIR light are absorbed by mitochondria, specifically the enzyme cytochrome C oxidase. This leads to increase in ADP, cellular energy, production. Decrease oxidative stress. Decrease pro-inflammatory cytokines. Increase nitric oxide signaling, improved circulation. Increase cellular repair and regeneration. In simple terms, cells work more efficiently and recover faster. Photons. Mitochondria. ATP. Inflammation. Circulation. Gene repair. Tissue and nerve healing. Mitochondrial activation, primary mechanism. Cytochrome C oxidase, CCO. Red, 630 to 660 nanometers, and near-infrared, 810 to 880 nanometers. Photons are absorbed by cytochrome C oxidase, a key enzyme in the mitochondrial electron transport chain. This leads to increase electron transport, increase mitochondrial membrane potential, increase ADP production. Result: cells have more usable energy to repair, regulate inflammation, and function normally. Nitric oxide, NO, displacement and signaling. Under stress or inflammation, nitric oxide, NO, can bind to CCO and inhibit mitochondrial respiration. Red/NIR light displaces NO from CCO, restoring ADP production. Freed NO then causes vasodilation, improves microcirculation, enhances oxygen delivery. Result: better blood flow plus restored cellular respiration. Reactive oxygen species, ROS, signaling, controlled, not damaging. PBM causes a small, transient increase in ROS. This acts as a cellular signaling trigger, not oxidative damage. Activates protective pathways. NRF2 antioxidant enzyme production. SOD, catalase, glutathione upregulation. Result: cells become more resistant to oxidative stress over time. Gene transcription and growth factor modulation. PBM activates transcription factors such as NF-kappa B, regulated, not overactivated. AP1. CREB. This leads to increased BDNF, brain-derived neurotrophic factor. Increased VEGF, angiogenesis. Increased TGF-beta, tissue repair. Increased collagen synthesis, fibroblasts. Result: enhanced healing, nerve repair, and tissue remodeling. Anti-inflammatory immune modulation. Decrease pro-inflammatory cytokines. TNF-alpha. IL-1 beta. IL-6. Increase anti-inflammatory cytokines. IL-10. Shifts macrophages from M1, inflammatory, to M2, repair, phenotype. Result: reduced chronic inflammation without immune suppression. Nervous system effects, neuromodulation. Peripheral nerves. Increased axonal transport. Increased myelin repair. Decreased ectopic nerve firing. Central nervous system, with NIR. Penetration through scalp and skull. Increased cerebral blood flow. Increased mitochondrial function in neurons. Result: reduced neuropathic pain, improved nerve signaling, potential cognitive benefits. Calcium ion channel modulation. PBM affects light-sensitive calcium channels, e.g., TRP channels. Leads to controlled Ca superscript 2 influx. Ca superscript 2 acts as a secondary messenger for cell repair, neurotransmitter release, muscle relaxation. Result: improved neuromuscular and cellular signaling. Biphasic dose response, Arndt-Schultz law. Low to moderate doses produces stimulation and healing. Excessive doses produces diminished or inhibitory effect. This explains why more light is not better. Precise dosing matters clinically. Systemic, whole-body, effects. Although light is applied locally, PBM can cause release of circulating anti-inflammatory mediators. Improved autonomic balance, parasympathetic activation. Reduced systemic inflammatory burden. Result: benefits may occur beyond the treated area. Mechanism summary, simplified flow. Photons. Mitochondria. ATP. Inflammation. Circulation. Gene repair. Tissue and nerve healing. Health benefits of red light therapy. Skin health and anti-aging. Collagen production. Red light stimulates fibroblasts, increasing collagen and elastin, which can reduce wrinkles and improve skin elasticity. Wound healing. Promotes faster repair of cuts, burns, and scars. Acne and inflammation. Reduces inflammation and can help with acne and rosacea by calming irritated skin. Pain relief and muscle recovery. Joint pain and arthritis may reduce pain and stiffness in conditions like osteoarthritis and rheumatoid arthritis. Muscle recovery speeds up recovery after exercise by reducing inflammation and oxidative stress in muscles. Nerve pain can aid in neuropathy or peripheral nerve injuries. Hair growth can stimulate hair follicles, especially for androgenetic alopecia, pattern baldness. Often combined with specific devices like laser combs. Inflammation and immune support. Reduces pro-inflammatory markers, which can help with chronic inflammation-related conditions. Enhances cellular energy, ATP, production in mitochondria, potentially improving immune function and cellular repair. Mood and cognitive function. Some evidence suggests it may help with seasonal affective disorder, SAD, or general low mood. Cognitive performance. Near-infrared light applied to the head may improve memory and executive function in older adults. Circulation and tissue oxygenation. May increase blood flow and microcirculation, aiding tissue repair and reducing fatigue. Eye and brain health. Certain near-infrared wavelengths can penetrate the skull or reach ocular tissues, potentially benefiting retinal health or brain mitochondrial function. Safety profile. Generally very safe when used correctly. No known carcinogenic risk. Eye protection recommended for facial use. Avoid direct use over active cancer sites. Thyroid, routine use. Pregnancy, abdominal area. Who tends to benefit most? People with chronic inflammation. Osteoarthritis or musculoskeletal pain. Neuropathic symptoms. Slow wound healing. Age-related tissue degeneration. RLT is a reasonable adjunct therapy, especially targeting neck, upper back, and muscle groups, provided expectations are realistic. What it does not do. It is not UV, does not tan skin. It does not cure cancer. It does not work instantly, requires repeated sessions. It is supportive, not a replacement for medical care. Recommended frequency, how often? Red light, 630 to 660 nanometers. Frequency, 3 to 5 times per week. Distance, 6 to 12 inches. Time, 8 to 15 minutes per area. Consistency beats intensity. Allow at least 24 hours between sessions on the same area. Typical course, 4 to 6 weeks. Maintenance phase, 1 to 3 sessions per week. Key scientific, peer-reviewed, references for red light therapy. 1. Mechanisms and reviews. Glass GE. Photobiomodulation, the clinical applications of low-level light therapy. Aesthetic Surgery Journal. 2021, 41, 6/7/23, 738. Reviews clinical evidence for red/near-infrared therapies across skin rejuvenation, acne, alopecia, wound healing, and more. Photobiomodulation, a review of the molecular evidence for low-level light therapy. PubMed. Summarizes molecular and cellular mechanisms of PBM, including oxidative and mitochondrial effects. Low-intensity light therapy, exploring the role of redox mechanisms. PubMed. Discusses redox and mitochondrial signaling induced by red/NIR light. Immunomodulatory effects of photobiomodulation, a comprehensive review. Lasers in Medical Science. 2025. Examines immune and cellular pathways modulated by photobiomodulation. 2. Clinical applications and evidence. Photobiomodulation, the clinical applications of low-level light therapy. Aesthetic Surgery Journal. Clinical outcomes on skin and aesthetic uses with assessment of evidence quality. Clinical evidence of photobiomodulation therapy, PBMT, on implant stability and success, systematic review and meta-analysis. BMC Oral Health. 2019, quantifies clinical data on PBMT for healing and implant outcomes. Photobiomodulation for the treatment of retinal diseases. A review. PubMed. Reviews preclinical and clinical evidence on retinal and neuro-ophthalmologic applications. 3. Mechanistic and specialized studies. Low-level light therapy of the eye and brain. PubMed. Details mechanisms of cytochrome oxidase photoneuromodulation and neural metabolism. Transcranial red and near-infrared light transmission in a cadaveric model. PubMed. Examines tissue penetration of red versus near-infrared wavelengths relevant for neural PBM. Notes for research. Terminology. Scientific papers often use photobiomodulation, PBM, or low-level laser/light therapy, LLLT, instead of red light therapy. Searching those terms yields more results. Wavelengths. Most studies focus on 600 to 1000 nanometers, visible red to near IR range. Quality of evidence. Clinical results vary widely by wavelength, dose, and device type. Stronger evidence exists for wound healing, tissue repair, and some dermatologic uses. Light spectrum data collected. Light spectrum data collected. Brainicity brain enhancement. The next step in human evolution. Bilateral and binaural audio and video files. Reduce stress. Awaken consciousness. Support healthy brain function. Introduction. Unlock your brain's potential. At Aloka Biotechnology, we believe that true health and wellness come from optimizing every aspect of your body and mind. That's why we're offering our Brainicity Brain Enhancement System, designed to enhance your cognitive function, memory, and creativity. Our approach to brain enhancement sets us apart from the competition, as we address not only the physical but also the emotional and mental aspects of brain health. Take advantage of this offer now and experience the benefits of a sharper, clearer mind. What is Brainicity? Brainicity Brain Enhancement, a system that uses audio stimulation, has evolved into the Brainicity Brain Enhancement System, a system that uses a unique combination of audio and video stimulation. Brainicity generates a unique waveform with a specific number of harmonics. This special waveform at different frequencies are fed into the brain using audio and visual stimulation. The heart produces electromagnetic signals, which is called electrocardiography, ECG, or the heart biofield. The brain produces electromagnetic signals, which is called electroencephalography, EEG, or the brain biofield. The brain produces an erratic biofield that can be deciphered. Brain waves are classified by frequency as delta, theta, alpha, and beta waves. Delta, 0.5 Hz to 4 Hz, is seen normally in slow wave sleep. Theta, 4 Hz to 8 Hz, is seen in drowsiness, meditation, and creative states. Alpha, 8 Hz to 12 Hz, emerges with closing of the eyes and with relaxation, and attenuates with eye-opening or mental exertion. Beta, 12 Hz to 30 Hz, is associated with active, busy, or anxious thinking and active concentration. Gamma, 30 Hz to 42 Hz, modulate perception and consciousness. A greater presence of gamma may relate to expanded consciousness. Brainicity uses integrated harmonic wave audio patterns to facilitate multiple brain biofield resonances. Too many harmonics can cause the brain to be overwhelmed because it has a limit of how much information can be processed at a given time, resulting in the brain ignoring the inputs. Too little harmonics will not be effective. An integrated wave will produce a limited number of harmonics, which can be interpreted by the brain. Resonance occurs when the frequency of a periodic waveform is in phase with an external periodic waveform of equal or almost equal frequency to the internal frequency. This causes the system to oscillate with a larger amplitude than the force applied at other frequencies. Waveforms in the frequency range of 0.5 to 20 Hz are below the human hearing range. In order for the brain to be able to sense brain wave frequencies it cannot hear, binaural application of different frequencies are applied to the brain. The difference between two frequencies produces a third frequency, which is within the human hearing range of the brain wave frequencies, brain biofield. Then, the resulting complex pattern of waveforms are set to achieve multiple resonances with the brain's own waves. There are three types of brainicity selections: brainicity resonance, brainicity binaural, and brainicity bilateral. Why so many? Because different people relate to different frequencies and patterns. Brainicity resonance sends unique brainicity pattern frequencies that resonates with the brain via speakers or earphones or headphones. Brainicity resonance can be used with headphones, earphones, or speakers. BrainicityTM binaural sends different unique brainicity pattern frequencies to the left and right ears via headphones or earphones. The brain will produce a third sound. Brainicity binaural can only be used with headphones or earphones. Brainicity bilateral sends different unique brainicity pattern frequencies back and forth to the left and right ears via headphones or earphones. The brain will react to these sounds. Brainicity bilateral can only be used with headphones or earphones. In a clinical study, the Brainicity system, formerly known as neuropath, caused an immediate increase in alpha brain waves and relaxation. Just sit back and relax. Emotion arises from stressful situation. EEGs of subjects were measured while they are alert, during rest, and during neuropath sessions. The waveforms above are from a typical subject in the study. Note the increase in alpha wave activity during the neuropath session. Delta is seen normally in slow wave sleep. Theta is seen in drowsiness, meditation, and creative states. Alpha emerges with closing of the eyes and with relaxation, and attenuates with eye-opening or mental exertion. Beta is associated with active, busy, or anxious thinking and active concentration. Brainicity was formerly named neuropath. Parts list. Luxrite A19 LED red light bulbs, 60 W equivalent, non-dimmable, UL listed, E26 standard base, indoor-outdoor, porch, Christmas, decoration, party, holiday, event, home lighting, 3-pack. LR 21495-3. $19.99. Adesso 3 light floor lamp, natural wood base and adjustable brightness, perfect lighting for bedroom, living room and corner decor, beige. $64. Parts list continued. Desktop computer of your choice. Brainicity USB drive. Edifier M60 Multimedia Speaker Bluetooth 5.3, 66 WRMS, high-res audio and high-res wireless audio, LDAC 3-inch mid-bass and 1 tweeter, USB-C and AUX inputs, compact desktop speaker, classic oak. $170. Do you want to build this system? Contact Dr. Aloka at dralaka@icloud.com. www.aloka.com. More information. For more information, visit www.aloka.com. Essential Health, a journey to total mind-body wellness. Join the Essential Health program today because healing isn't just possible, it's essential. Essential Health Wellness Facilitator Training Program. Essential Health, a journey to total mind-body wellness. Train in advanced nutrition, brain enhancement, neurochemical reprogramming, biometric health assessment, connecting to nature, and light therapy. Step into the future of mind-body wellness.